Hi everyone, it's Erica here, your classmate from Nursing 101. First, before I get started, I just would like to thank you all for, communicating with me and dialogue with, during our discussion posts. I really enjoyed reading a lot about, you guys, like your future and how you see yourself to where you see yourself to be within the next few years. A lot of us share the same like goals or paths, and I just want to say thank you all for participating, as we engage amongst each other in this online course. And some points I like wish I was on site with you all, but it's an online course and I'm thankful for it. It's really good. So we in module 1 we discussed where we would see ourselves later down this road, and I've also included my module 1 discussion post inside my PowerPoint, so you can scroll down a little bit towards the bottom and you can read a little bit about what my future goals are. Currently, I'm an LPN, of course, as we all are, and I plan to pursue my LPN to RN, then my RN to BSN, and then I wish to receive my complete the nurse practitioner program and pair it with the nurse educator, because I just I love the fact that nursing, you can go like it's not just like you're grounded in one spot. You can just do so much with it, and I'm really have a love for nursing and the educational part of it. I honestly see myself on the other side of this program one day, fingers crossed. But yes, I really enjoy sharing the knowledge that I have taken in and gained throughout my experience in healthcare. I've been in healthcare for over 28 years now. First as a candy striper, I work in the x-ray department, where I would help patients obtain their results. I've worked as a phlebotomist. I've worked as a surgical technologist for 10 years in L&D. I really enjoyed ortho and plastic surgery of the head and like the nose. I've worked in so many settings. It's like I would keep you all day with that. But in nursing, as an LPN, I worked in the field with community nursing, which I really have a love for, being out in the community. I think because working as an LPN and doing community nursing, you have the chance to educate patients. So there I go again, loving the educational part of it, where you wouldn't get to do it so much in the in the New York magnet hospitals. You can kind of touch base on what the RN said, but in the home you have a little bit more autonomy in the community when it comes to dealing with patients. So that's where I choose to be down the line. I want to talk about, I want to discuss how nursing has evolved. It evolved in so many ways, and I can, once again, keep you all day talking about it, and I get excited, honestly, talking about how much nursing has evolved. And my PowerPoint is about the evolution of the nursing role for RNs. It's become so integrated in technology. You can have remote positions. Not like nursing is just not in the hospital and facilities anymore. You can do remote. As an LPN, I've had remote positions, so I have experience, but it gets more in detail where you get to create care plans, and have more communication with the patient if you are an RN, because these positions you have to provide a care plan even online, and they're having telehealth visits. So with telehealth visits and telemedicine, whatever you call it in your state, it has like goes by different names, but it kind of means the same. You focus on preventative care and chronic disease management. So I want to discuss a little bit about that. First, I want to talk about how telehealth and remote monitoring has become very popular, especially in New York City, and more so during the pandemic. A lot of nurses left their their unit jobs or their floor jobs, because these telehealth appointments became, more in demand, especially because, we were facing a pandemic during 2020. So there were, less traffic going on in facilities. So I honestly think that was good for not only for the healthcare staff, but for the patients as well. It was a way for them to stay safe, stay in their homes. It saved money, of course, because they don't have to commute, or it saves them stress. It definitely telehealth visits definitely decrease the stress of patients, because they can have these appointments in the comfort of their own home without looking for anyone to accompany them to the visit if they can't, if they don't have their own means of transportation. It helps them, save time, not only money, and anything that helps you save time and, time and money on transportation reduces your stress. So that also is helps towards the goal of the patient, because they're reducing their stress, right? Not having to hustle and buckle to these appointments. So definitely, technology has played a major part in healthcare, especially after the pandemic. Like, there are a slew of positions that became available. Myself, I worked as a LPN care manager, where I would get alerts about patients that were admitted to the hospital, and the health insurance company at that time I was working was United Healthcare. I would get an alert that a member was admitted to the ER, and I would find ways for them to, have less ER visits, because sometimes patients use ERs for their primary care because they can't get to these appointments. So once they really fall sick, it alarms a ER visit, which is bad. So best thing you want to do is for the patient to follow up with their appointments, manage their health, their medication management, and bridge any gaps, because there are a lot of gaps in healthcare. And making appointments is one of them. So nurses can bridge the gap by participating in these positions, these open positions that allow patients to have their appointments online. And the same thing that happens at a doctor's office can happen during the telehealth visit. The patient can get their medications, their referrals, all sent the same way, but just doing this as we're doing now, online. So I think that's really great how nursing has evolved, especially after 2020. Technology has definitely refined nursing. Nursing takes place in the home, telemedicine visits, and the nurses, the healthcare providers still have access to the patient's clinical data. We still have to follow the same regulations as you would in a hospital, and that means if you're working from home and you had to print something out, nothing about the patient should be lying around your patient home. You still should be HIPAA compliant, even in your work office setting. So everything still remains. Whatever you do in the hospital or your clinical setting, that has to take place, even if you have your home work office, which I do, because I currently work in the field as a visiting advanced wound care LPN, and I have clinical data on patients, but it's all secured in my work device. I don't really have the need to print out anything, but if a patient does hand me something that needs to be scanned in, I read those documents the same way as we would in a hospital. I'll upload it and provide the office the main copy, or shred it right away, because there's no reason to keep hard copies in my work office. Let's talk about which we have already done, but how nursing have transitioned from the home to the community to work office. So let's say I did my research that telehealth or telemedicine started really in the 1970s, but it wasn't a big hit. The widespread of telemedicine didn't begin until 2020, of course, which I've already mentioned. Telehealth found its way in the early 20th century, and it widespread integrated into managing and assisting nurses during the height of the pandemic. So we already reviewed that. less telemedicine, you know, it still helps patients focus on preventative care and chronic disease management. So it's kind of like what a nurse would do in the community or the hospital, but just at the home, as we're doing now. We would have a face-to-face appointment visit with a patient, and things will remain the same. Early detection, healthcare education, what else takes place in those visits? The patient that, you know, their vaccines, the nurse can still review, you know, the patient's medical records, so we would still make sure that they are vaccinated. Nurses review chronic disease management with the use of RPM. What are RPM devices that the patient can have in the home would provide the nursing those readings. So you have a scale, the patient, and also some programs, which is great because I even received one myself. Health insurance companies are mailing these RPM devices to assist during telehealth visits. How awesome is that? So when I first started in community health, the company paid to had trial runs for these patients. So we would give them the iPad, the glucose meter, scales, blood pressure cuffs, everything. But now, so exciting, the insurance companies are providing the scales, are providing the blood pressure cuffs, the glucose meters, etc. Even the pulse ox machine. After the pandemic, everyone got a pulse ox machine. It was like free for everybody. During my assignment that I had at the Javits Center in the hotel project, we were just giving them away like they were candy. So that's another bonus that happened during the pandemic. If you reach out to your insurance, you don't need a prescription for RPM devices. Your insurance company will mail that to you for free, or provide a script to your local pharmacy where you can go ahead and pick that up with no copay. Because those devices are helping you manage your health and stay healthy and keep track of things. Another thing that takes place during telehealth visits that patients are afraid that this won't happen. The pharmacy, your patient's medication, their DME is transcribed to the pharmacies the same way. I honestly think this is better because I find myself now, when I can see that I don't get to call the medications now, but that time will come for me. But what I do is I'll go into the section where I can find if a patient medication or DME was called in, and I'll actually reach out to the patient's pharmacy to make sure that it's filled and actually in the bag and ready for the patient to pick up. Because what happens, the gap in healthcare where prescriptions are sent to the patient's pharmacy, but when they get there, it's not there. So possibly it was for an insurance issue. The patient possibly needed pre-authorization. So I make sure that all those avenues are clear. So when the patient get there, that medication is actually in the bag. And I'll even ask the pharmacy or the pharmacy tech, hey, is that medication ready for the patient to pick up? Because this happens so often. A patient will go to a provider's appointment. The provider tells the patient that the medication was called in. The patient gets to the pharmacy and the medication is not there. It's not available. It needed pre-authorization because some pre-auth only lasts 6 to 8 weeks to 3 months or something like that. Or the medication is a managed medication like a GLP-1 medication, an insulin, where the patient has to have a visit every 90 days. So when the patient goes to pick up the medication, it's not there because they're over a day from picking it up. A whole slew of things that that leaves this big space for a patient, and now they have a gap in care. So I like to fill those gaps with my patients. Lab reviews and interventions, that all takes place during visits, and like I already discussed, it reduces the cost. So much that can take, so much you can do with nursing and telehealth visits and education. I like both. I want to become a nurse practitioner and an educator because they're two different degrees, but I just find such joy in doing it for patients. So I know that this is like where I need to be. Because a little to go off the project a little bit, I also teach a CNA course at my local CUNY college at York College. So I do a CNA course there, and I love it. So nursing, you can do so much and go so far. The future of healthcare and nursing, you know, just discussing patient's goal, you know, is essential for the patient's well-being. It helps the patients reach their goal. So education and communication with a patient, you know, just always remembering patient-centered. So at times we may have a patient, but the patients may rely on family members to maybe communicate for them, or their spiritual person. So just making sure that we cover all those spaces, not letting the patient feel left down because we didn't include their family. Their families are definitely, you know, to be a part of their care plan. Their doctors, their social workers, any community needs. Everyone comes together so that we can have the best outcome for the patient. Nursing also comes in a non-pharmacological method, and that's called holistic nursing. Holistic nursing is also another way a nurse can get some education in there, but focusing on the patient, the mind, the body, and the soul, the overall patient, making sure that the patient, that we're not just focusing on their diabetes, we're focusing on their mental, making sure that their mental and their mind is stable, their body. Just because they have a diagnosis of diabetes doesn't mean that their body is totally down. No, their pancreas is just not functioning right, but the insulin and the medication is helping, but their whole body still needs to be taken care of, and their soul, their spiritual setting, offering relaxation techniques like acupuncture, massages. Those things can really better the health of a patient. Aromatherapy, I love scents. I'm obsessed with like lavender. Those things just make me feel so good, and it's not I don't have to pick it up from the pharmacy. I can in the OTC section, but I don't need the pharmacist to help me, you know, with certain relaxation techniques like aromatherapy and the mist, the diffusers. You know, those things help people feel really good. Transitioning from the role of an LPN to RN, I'm excited about it. Transitioning from the LPN to RN, I have identified multiple areas where once we're all done with the program, where we can work. Clinical setting, of course, but my honest goal is patient education, remote, some telemedicine, also some teaching in the community. I would love to have like a community van where I provide some teaching and education for patients, the same way I would do on a televisit before the community. My goal is to build ultimate leadership skills as I commit to my new lifestyle as an RN. I see nothing but positive change for myself, and also my holistic self, for my, you know, my well-being, because I honestly feel good like when I'm sharing information with others. And just to say, at the end, as we wrap this up, I really wish you all the very best during your path as we all go down this path together. Some of us are going opposite ways as we have, you know, other, you know, different dreams and goals, but the end result is to just stay focused and say to yourself, even when it gets hard, that you can do it. And hey, try some of the holistic practices if you can. Go for those massages, acupunctures, therapies, grab some aromatherapy, and I wish you all the best. And thank you for listening to this almost 20-minute long video. And if you don't want to listen to the video, please review my slides. Wishing you all the best. Thank you.